Hey there, all my speechy friends. So if you are a speech language pathologist and you are working with a pediatric caseload, I want to talk to you for a second because I am willing to bet that you have tongue thrust on your caseload and you're not recognizing it, okay? And the reason I am so bold as to say that is because I was where you are, okay? Many years ago, I was in an outpatient medical clinic treating traumatic brain injury, strokes, degenerative diseases, very much with a neuro focus, right? And suddenly I have on my caseload a referral for tongue thrust, a 14-year-old boy who had no developmental delays, no disorders, no articulation errors. But he had a referral from an orthodontist for tongue thrust therapy. And I did not know what to do. I didn't receive that training in university. I didn't receive it in my CF because I was really on a neuro path. And I had done pediatrics, and technically a 14-year-old would fall in that pediatric realm. But they're kind of, we treat them a little bit more like adults, right? But the bottom line is I didn't know how to treat. So I did what we are trained to do. I got into the research. I looked at the literature. I reached out to my colleagues and my mentors. And what I found was pretty abysmal, actually. The standard practice was, and still is today, a year of treatment and then followed up by tune-ups. And of course, immediately I'm like, okay, well, this is not going to work in this setting because there's no way that an insurance company is going to pay for a year's worth of intervention. And even if they did, what 14-year-old with no delays or disorders is going to stick with a tongue thrust program for a year, let alone come back for tune-ups, right? So I did though. I mean, what else am I going to do, right? I started to implement the programs that were standard practice and best practice because honestly, there really was, in my opinion, no best practice for tongue thrust at that time. And so I just, again, like we do, we use our clinical judgment and we take the tools and the things that that work and we kind of try them on this patient. Will it work for this patient? Will it work for this client? And what I found out was, wow, I was able to eliminate the tongue thrust and it did not take a year, right? And so you might have experienced this, right? If you treat something and you have a good outcome, the word gets around and suddenly, all of a sudden, right, they come in packs. And so you get more and more of the same thing. And so this pattern started to develop. And what happened was over the years, I treated many kids and they were all teenagers. They were all coming from the orthodontist because that's who they were really happy with my outcomes. And parents would tell other parents, right? And so they would come in and, after a while, we started to notice a trend, right? These are kids who are coming in who don't have articulation delays or disorder. They're normals. And we don't get trained for that in the university, right? We get trained for disordered populations. And we do know what normal development is because that's what we compare to. But we really, what do you have when it's just cosmetic? And then I got into recognizing this whole, there would be some orthodontists who didn't even believe in tongue thrust. They didn't even think it was a thing. So just understanding that really it was all about oromyofacial and, again, what 14-year-old wants to be told that they have an oromyofacial disorder? It's just so intimidating. So the cost, the research, it was all so fuzzy and expensive and unattainable. And so I started to recognize that we were getting unusual outcomes. They were atypical. We were not just treating the tongue thrust, but we were eliminating it. And these were with kids who were, 8 to 18 really is where it was developed. But these kids were coming in who'd had multiple braces on and their teeth would just go right back. And finally the orthodontist would be so frustrated that they would send them to us and we'd get rid of the tongue thrust and their orthodontia would stick. And the parents were thrilled because suddenly, that investment actually pays off. So that's kind of the history and why I know, as I've treated this now for many years, that tongue thrust is often, that's not even a word, often misunderstood or not recognized. So as I've worked in a variety of settings with kids and actually all ages, I recognize and I use these tools from the protocol across my caseload. And other people recognize it. They're like, wait a second, how are you getting these residual R's and these kids who are stuck in secondary grades with articulation disorders? And I'm like, well, I don't know. I use my tools, right? Because they work. And I started to understand and recognize that some of the things that we do, again, I've trained this for years, that tongue thrust is misdiagnosed. It's not it's underdiagnosed. It's not recognized as a contributing factor. So I think if you're in the schools or if you work with the littles, you're recognizing it maybe in placement or in their orthodontia. You are starting to see the jumbo dentition or the open bite or the overjet, right? But you're not making the connection of what your role is in eliminating that, maybe because you're in the schools. And if you're in the schools, right, we don't address the swallow. So there's just so many reasons that you don't know what you don't know about tongue thrust. So, there's so much to know, and I've learned it over many, many years and refinement across settings, across ages. And as I've taught, in certifying and teaching different professionals, I recognize you come in with different levels of knowledge. I call it putting on new goggles. So I'm going to teach you some new goggles. And as I teach you these new goggles, you're going to be able to take it and apply it to your age group and your setting and go, oh, that's how tongue thrust is sabotaging my outcomes. So how are we going to do that? I have a webinar that's coming up, and I want to get in and I want to teach you to recognize the tongue thrust that's already on your caseload and what you can do about it, right? Because that was where I started. I started with, oh my goodness, here's a referral. And it was obvious because it said tongue thrust. Although when I, first looked at him, I never would have picked him out of the traditional tongue thrust lineup, right? He didn't have, like I said, he didn't have any of the articulation errors. He didn't have crooked teeth because he'd already been in orthodontia and he was coming back for a tune-up. Okay? So that's what I'm going to teach you in the webinar. I'm going to teach you to recognize the tongue thrust that's already on your caseload as you head back to school, to go into that caseload management with some new goggles. If you're in working with these kids on the summer is a time when parents really want to get through those artic errors, right? Get them out of speech therapy so that they don't have to go into it in the school. They don't have to be pulled out of the classroom. So there's just a lot of reasons that now is the perfect time for you to get this skill set, because I guarantee you didn't get it in the university. You didn't. You haven't gotten it in your training because it's too specialized, right? In the university, we're getting a broad foundation. There's so many skills in our broad scope of practice that you can't possibly, you know as well as I do, that most of what you use on a day-to-day basis, you have picked up in practice. You have picked it up on the job from colleagues or continuing education that you have experienced. And so I'm offering that to you. I want you to come to the webinar and figure out how is tongue thrust sabotaging my caseload, and how can I recognize it? What do I do about it? Okay. So, the STTP Training Center is an online training center that is all things tongue thrust. We started from those humble beginnings of just a frustration with inadequate practice, really, to be able to address it. And then we realized that we were onto something. And I realized that now it's been validated across many, many, many clients, patients, students, and professionals. So we certify the professionals and we teach you, and we also help the parents to know and understand and recognize what it is and what can be done about it. Because honestly, there's a lot of misinformation. I think we're making progress, and there's better skills and there's better tools. And then I get online and I look, and it's just a bunch of garbage. It's not true. Even the definition of tongue thrust and the resting posture and the manifestation as early as yesterday is inadequate on Wikipedia, on general information. So you as the professional, it's incumbent upon us to not perpetuate that misinformation and to be able to recognize it, right? So come to the webinar, come and get some new goggles and elevate your therapy skills for tongue thrust so that you can really address that and just take it to the next level. And how you do that is there's going to be a link somewhere around this video that's going to have the link for you to be able to register for the webinar. So register for the webinar, come and join us. It's going to be on July 20th at 10 a.m. Mountain Time. So if you're on the East Coast, it's going to be noon. And if you're in the Pacific time zone, it's going to be 9 o'clock a.m. Okay, so 9, 10, 11, and 12, depending on where you're at in the country. And if you are international, we welcome you too. We do have some people who come to us from Australia and from Europe and some of the Asian countries. So come on in, you're welcome to. I don't know everybody else's time zones, so I'll need you to adjust, but it's going to be live webinar on July 20th at 10 a.m. Mountain Time in the United States. And we're just going to teach you to put on some new goggles and to recognize what's right in front of you, but you can't change something you're not aware of, right? So we'll see you on the 20th. Register now. Don't miss this opportunity. We'll see you later.